My name is Tony Diniz. I work for Seva. Seva is a pharmaceutical industry for animal health. It was created in 1999, so 20 years ago. We are dedicated for both biological and chemical products provided in more than 115 countries. And in Seva, I'm the French microbiologist referent for all the product manufacturing sterile in France. In our microbiological lab, we test different kinds of samples for endotoxin. First, we have the raw materials, API and excipients, also water for injection. The limits we faced with the pure method is that we cross from 10 samples points of use for water for injection to 80 points of use. Knowing that one sample made 20 minutes to be analyzed, we have to improve a method and our technique. So that's why we decided to go to Endozyme Ii Go, because this last technique were not suitable to perform, for example, a qualification, knowing that during the qualification step you have to analyze your all 80 samples at the same day. If one sample is 20 minutes, imagine the time or the day that you need to perform the analysis. So the first point, he was of course for productivity, to win some time, also some costs, and also for the ethical part. Working in an animal health industry pharmaceutical company, we wanted to reduce our animal resources to make analysis. So that's why Endozyme Ii Go was a good alternative to win in productivity, but also to respect ethical value. We did a training with Biomerieux and the technicians from the lab during one day. First morning was a theoretical part for the toxins and also for the technique of RFC. And during the afternoon, we choose different technicians to be the referent of the technique. And the last 2 days, we did the validation. Because it's an alternative method, you have to prove that this one is compendial and equivalent to the old one from the pharmacopoeia. So we did that together also with Biomerieux and the technician from the lab. And because we need it for the qualification of the water loop, we did the analytical validation with the water for injection. So during this validation step, we did not have or found any difference from the method D from pharmacopoeia and the RFC, which allows us now to monitor the water for injection only with the RFC technique. We implement this new method in January 2019, and now we are able to release raw materials with this RFC method. So we did the validation for more than 6 raw materials using RFC method. Endozyme Ii Go helped us to improve our endotoxin test in different points. First of all, we are using a pre-coated plate. And because it's a pre-coated plate, there is less human error and less invalid results. So using the RFC for 1 year now, we saw that the overall rate of negative control used to validate sample is very reproducible, as the rate varies from 90 to 110%, which is very low compared to an in vivo source that goes from 70 to 150%.